Effective support for those experiencing perinatal OCD improves day-to-day coping and, crucially, can be life-saving. It is equally important to remember that those who provide this essential support, sometimes for years, need to be cared for and also listened to. This is a reflection on 20 years of providing peer support in the UK and, in some cases, Europe. For those of you who think you might have OCD or have a diagnosis, it can be a really upsetting time in your life when you recognise that something feels not quite right. You could be experiencing horrible thoughts which are frightening and confusing. You just want them to stop, but no matter what you do to try to stop them, they just keep coming back again and again. OCD thoughts, images, impulses and urges could be around dirt and germs, losing control and doing something dreadful. Thoughts of a sexual nature or doubts about whether you actually love your baby. If you are considering getting a diagnosis of OCD, this is a step in the right direction. The initial step is for mum, the parent or birthing parent, to consult with someone who has a sound understanding of OCD, whether they are a psychiatrist, clinical psychologist or cognitive behavioural therapist, as CBT continues to be the evidence-based treatment of choice. When people are about to receive a clinical assessment or evaluation, they often have a pretty good indication beforehand that they have OCD from the vast amount of information available online. Even if you don't get a diagnosis for this disorder, you can now focus on the appropriate treatment for you. Let's look at online information. It's so easy to fall into the trap of looking for answers when you just want to feel safe and sure for yourself and your baby. Your heart is naturally wanting to protect, and reading more can feel like the most responsible thing to do. However, this constant seeking can sometimes pull you further away from the peace you're looking for. When reading becomes a compulsion, it's like trying to put out a fire with more wood. Every new article or forum post provides a tiny moment of relief, but ultimately keeps the fire burning. It keeps scanning for the what-ifs or comparing your story to others. You deserve this precious time with your little one without the exhaustion of endless searching for certainty online. When you decide to be open about your thoughts, you will know when it feels right to talk. No medical professional will force you to speak, but they will probably get a sense that you are struggling to be open about your fears and thoughts. Good therapists will work with you to help you to talk, and no thought, however disturbing it feels to you, will shock them. You might be pregnant, or you might already have a beautiful baby who needs you to be well. If you are struggling to feed or bath or change nappies or to hold your baby, this is a sign that you need to get help. You don't have to open up about your most frightening thoughts, urges, impulses or images until you feel ready to do so. A good understanding CBT therapist will work with you to help you to try to put a stop to you pushing these uninvited thoughts further down and trying to bury them. It can be done. So what happens if there is no support and no one to talk to about your OCD within your family and friend group? This is tough, but it will be okay, as there is actually only one person who needs to hear your unwanted thoughts, and that's your therapist. They need to know everything, and a good therapeutic relationship will be enough. It might also be helpful to discuss the lack of support you have in your life. When the time comes for you to begin your treatment, you understand your OCD, you get it, and you quite rightly should expect your therapist to get it. If they don't, there might be a problem here for you moving forward. At the beginning of therapy, it will be helpful to discuss with your therapist about the type of therapy you will be given. If you are given breathing exercises, or if you are told to put your thoughts in the bin, please see these as red flags. Instead, make sure you follow the NICE guidelines, which state the gold standard treatment for OCD is cognitive behavioural therapy, along with exposure and response prevention, called ERP for short, and sometimes SSRIs, which is a type of medication. So how will you know if you have had a good therapist? A good indication is that as you go through therapy, your CBT therapist will equip you with new ways of understanding the problem. They will give you the tools to become your own therapist without getting stuck in the same trap when intrusive thoughts reoccur, whether they are the old or new variants. I would like to add that in 20 years of giving peer support, I've never met anyone who has successfully been treated for OCD with a therapy other than CBT-based therapies or using ERP. There may be some people out there, but I'm yet to hear their success stories. Once you are in treatment and you have experienced reality testing, you will soon realise you are no longer a victim to OCD and the balance of power changes. I have heard heartwarming personal stories where mum has become so angry and furious at what the OCD has done to her and how it has robbed her of precious times and memories with her baby and children. She becomes an active fighter against the unwanted thoughts. Embracing the anger helps her dismiss the thoughts as she feels the OCD lose its strength. Today, treatment is usually as an outpatient, and video conference consultations are often as effective as meeting in person. Opening up a laptop at home for treatment can make it easier for you when you have a young baby, especially if you don't have to travel to see a therapist. Sometimes it is necessary to receive specialist inpatient care at a mother and baby unit. I have had the pleasure of meeting staff who work there, and they are there because that's where they want to be. They will be compassionate towards you, and you will have the freedom to ask them anything before admission. They will be supportive, and they are on your side. See admission as a protective place where you and baby can be cared for without pressure from the outside world. With perinatal OCD, the fear that you feel actually comes from a place of deep love. Your baby is the most important thing in the world to you, and the MBU staff will know this, along with their understanding of the unwanted thoughts which are terrorising you. Do look at our link where Alexa and Lucy from the Centre of Anxiety Disorders and Trauma discuss admission to a London mother and baby unit. If you feel you will never get through this, please know recovery is possible. Can you imagine getting to a point where you could even forget that you have had OCD? This is what you can aim for. Perhaps see the disorder as being similar to the experience of childbirth if it has been straightforward without complications. You don't really recall the pain of childbirth in the forefront of your mind until you're back in the delivery room again with the contractions, the pushing and the forceps. It is possible for OCD not to be at the forefront anymore, but rather something which is in your past. However, OCD still can come back with a vengeance, but having had good CBT means you will be better prepared to deal with it. So let's focus on giving mum support. On the face of it, she may put on a brave front to give the impression that everything's fine when clearly it's not. Please see her reluctance to talk as likely to be fear caused by the terror from the thoughts, along with the feeling of shame and guilt and embarrassment. She's not purposely trying to shut you out, nor is she trying to be difficult. She is simply trying to hold it together. Could it be that her silence speaks volumes? Perhaps her fears are too great to openly put into words because of the fear of speaking out. Mum's pain is so conflicting because on the one hand she doesn't want anyone to know the nature of her intrusive thoughts, yet on the other hand she's so desperate to talk to the right person. If Mum does open up to discuss her frightening thoughts with you, give her the time to speak without interruption. Let her talk. She may have wanted to talk to you about her unwanted thoughts for a very long time. Just listen. If she is in tears, hold her and let her know that she can get better and that there is good help out there. It requires such courage from her to speak out about the thoughts which frighten her so much. See this as a step forward and a signal to you that she is asking you for help. What happens when you have a situation where mum refuses to seek treatment? This can be particularly hard to deal with, as you will feel helpless, and it can seem that there's just no light at the end of the tunnel for you or for her. As the partner or carer, you can become what is known as the forgotten victims in all of this, and you're probably feeling exhausted. Change for the better is unlikely unless mum can access treatment, and without it, the OCD will probably continue to worsen. As a suggestion, remind her that it's not her fault that she has OCD. She is not responsible for having these horrible, unwanted thoughts. However, she is responsible for choosing whether or not to accept treatment, which is cognitive behavioural therapy, possibly medication, and to turn up on time for therapy appointments. This is where family and friends can step in to assist, help babysit little ones or hold baby while mum is in therapy. Mum may find treatment emotionally demanding and tiring after, so allowing her to rest and recover from a therapy session can be a critical part of her recovery. When living with and supporting someone with OCD, all of the hugs and cups of tea aren't going to be enough. You are dealing with a disorder. Sometimes, if these acts of kindness, though necessary, are prolonged for months or even years, family members and dear friends can become part of the problem, unintentionally playing a role in delaying treatment and getting caught up in compulsions. A gentle conversation between mum and loved ones might get her to see that there hasn't been much improvement, if any at all, without therapy. Our children are little for such a short time, and the perinatal OCD mind will limit those moments of joy with her children and baby, while being so intensely preoccupied and consumed with contamination and varying rituals. Instead, our energy should be focused on encouraging mum to seek treatment. Please don't give up on keeping the conversation going between the two of you if she is resisting seeking treatment. Sometimes family and friends don't know what to say or how to help. If you care for and love the sufferer dearly, you can say almost anything as long as you are sincere. You don't need to understand OCD, and it is difficult to understand. Just be kind. I would suggest reading information about perinatal OCD on the Maternal OCD website. As a family member, partner or friend, one of the most important steps you can take is to encourage mum to do the things she finds scary or difficult, rather than get caught up in the cycle of colluding with avoidance. I see this encouragement as tough love, which hopefully will lead to mum getting her independence back so that she can make decisions on her own without seeking reassurance. The therapist will talk you through this when you attend a therapy session with mum. To support long-term recovery, I'm wondering if it might help to consider visiting a support group once in a while, just to keep an OCD-free mind in tune with an OCD environment. This will be a good indicator for you to find out how well you are doing as you hear stories from the OCD community discussing their obsessional thoughts. This can also be a nice way to give back by listening to others, and this also gives those in the group the opportunity to see how well you are doing. This will give them hope and encouragement. If you are afraid to test the waters with your OCD, you may still have a little way to go, and this is avoidance. This paradoxically makes the OCD stronger by teaching the brain that the triggers are truly dangerous and must be feared. You can settle for this, or you can think about how far you have already come with your own recovery and how further along you could possibly be with further CBT. In the past, I have taken calls from family members concerned that their child or grandchild is picking up behaviours through observation from watching mum. Obsessional behaviours can be replicated from a young age, for example, kindergarten, where the child is trying to open doors or trying to turn on the taps with their cuffs. This observed behaviour is setting the young child up to be unnecessarily teased. this is a sign that psychological intervention is needed now. Receiving praise from a psychologist, psychiatrist, or CBT therapist can be a strong form of support for the sufferer and also for those that care for them. I can only hope that the medical profession make time to acknowledge these difficult situations at home and the relentless hard work undertaken by those living alongside someone with perinatal OCD. Their dedication, patience, and resilience has been evident to me during my time facilitating support groups, as they, more often than not, carry hope for recovery when the sufferer is so unwell. Throughout my time having been involved with peer support, usually I have been able to gently nudge most pregnant mums and new mums into considering accessing therapy, but not always. Sometimes I might not have been the right person to support them, particularly if they were very distressed. This is where it is so important that mum has time with a trained and trusted clinician where she can feel safe. Please remember, peer supporters aren't typically trained or qualified in psychology, and we can only go on our own experience when giving peer support. For those of you who don't have perinatal OCD, I want to try to explain what it feels like for mum when she experiences an OCD thought and the after effect from this example. Can you imagine a quiet room and mum's mind is screaming? For her, it's like watching a graphic horror film featuring her newborn. But there is no remote for her to turn it off or exit door for her to escape. The fear completely hijacks her, and in her OCD mind, she sees this fear as evidence that she could potentially cause harm or even death to her beloved child, who she loves the most in this world. This horror film isn't one she has chosen to watch, but rather something which is consistently replaying in her mind day after day. This is perinatal OCD. It is so hard when you are struggling with a profound sadness and a feeling that you might be beyond help. But please know, perinatal OCD is treatable, and there is someone out there who can help you. I have met many mums over the years who have either made wonderful recoveries or who now manage their unwanted thoughts well enough. It might mean you unfairly have to keep fighting within the NHS for the correct diagnosis or for the right CBT therapist. But just don't give up. Ask loved ones and friends to be there for you while you navigate the system. I wish you well finding a good CBT therapist who will walk with you. For some, even after their final therapy session, the really good therapists continue to walk beside us for a lifetime.